Hillary Clinton, years ago when they were in office, wrote this book called It Takes a Village.
Yeah.
And when I heard of that, I was in residency and I'm like, that is complete and total BS. I can do it all. Well, that was before children.
My kids are a product of the village. They have all of these traits and characters that I realize that I actually also had and have because I was raised by a village.
Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Join us for conversations on the bleeding edge of science, health, and culture as we bring you tech innovators, thought leaders, and the movers and shakers who are transforming science fiction into your new health reality.
Hi, everybody. Thank you so much for coming back to Hot for Your Health, where every week I just get to meet the most fascinating people. And I'm going to tell you without embarrassment, I have been watching this doctor since she first launched her Instagram account and pivoted her practice, which we're going to talk about today. But Dr. Dhivya Srinivasa is a meticulously trained, fellowship prepared, double board certified plastics and reconstructive surgeon. And the innovation that she has brought to the breast reconstruction world cannot go unnoticed, because even in the 25 years that I spent in academia, it was not something that I commonly saw. So we're going to talk to her today, but that's not all. If you have watched her for 1.5 minutes on Instagram or other social platforms, you will know that she is a fashion maven. She is a brilliant entrepreneur. She is a mother and wife. And we're going to talk today, surgeon to surgeon, about how we get all of this done. So thank you so much for coming today.
Thank you for that introduction. I got little goosies, and I got to tell you, how cool is it that two women surgeons get to talk like this? Because one of the most amazing things I think about you is how dynamic you are. And to be able to be so multidimensional as women, it's the best.
Why don't we start there then? And then we'll make our way to surgery. But I don't know if you ever experienced this in your training, but orthopedic surgery only had, when I was training, 3% women. And I am an orthopod who wears stilettos every day. I wear bright red lipstick when I'm not in my own home, right? And I like all those things, but I often felt, because I was young and in training, and that I couldn't be all that or all that I am. And so how do you, as all the things I described, brilliant surgeon, fashion maven, how do you stay authentic? Or how long did it take you?
Yeah.
If you weren't always where you are now?
So, I definitely had it easier than you. Orthopedic surgery is so heavily male dominated in a way that plastic surgery is not so much anymore. We're almost, I think, at 50-50 if you look at current trends as far as rates of men and women in plastic surgery. Wasn't 50-50 when I trained, but definitely a lot better than what you see in orthopedics then and even today, right? But I think, specialty aside, there is something about medical training, regardless of specialty in the United States, that pushes you to give up everything about yourself that isn't just just medicine. Being a father, being a mother, having any hobbies outside of work. Now, I think when you're part of the majority hobbies, being into football or whatever it may be, it's a little bit easier to get away with. But I felt the same thing. I actually felt inauthentic then, that I had to, I didn't talk about my kids in the OR, even though I wanted to be like, Ria took her first steps, or I had something I wouldn't say it. And I did general surgery first, which is a lot and usually enough for a lot of people. And I'd already had a kid by then. And so what I think when I went into plastic surgery training, I already felt the sense of, I'm tired of ignoring that side of myself. I'm just going to do me. It was still residency, couldn't do 100% of me, but I started crawling back into who I was, dealt with that, right? Dealt with what it means to be someone who's now having multiple children in training programs, and I cared a lot about my kids then, and I do now. And that, I think, rubs people the wrong way when you are in training, to show someone that there is more to you, or that your priorities can be more than your job. And this notion that there's a finite amount of you, and so if you're spending time on something else, that all of a sudden it's taking away from what you do at work. And I would challenge that notion, and I go, I am an ocean. It's infinite. Okay. So waves come and go, and I'm riding the wave that I'm on. Yeah. Night is different from day. Tomorrow is different from yesterday, but I am infinite, and everybody's getting the best part of me. And then I went into academia, and I tried it for 2 years. And I realized, you get into this, if I work harder, it'll be better. If I do more, it'll be better. Let me just publish a few more papers. And I realized that I was drinking the wrong Kool-Aid. It's just not true. At least where I was, for what I was doing. So I went private. And that's when I found myself.
I saw that transition, or a part of it. I don't know when you actually went, but I saw the public part of it. And you know what, for those of you that are not doctors and listening, the fact that you had multiple children in a surgical residency is nothing less than heroic, because no matter what people hear about the 80-hour work week, we work until the patients are taken care of, right? There was no real dropping off, and it just is not how you take good care of people. And so the fact that that you had multiple children, what did it take? And I'm going to tell you what it took for me first, and then I want to hear what it took for you. Hillary Clinton, years ago, when they were in office, wrote this book called It Takes a Village. Yeah. And when I heard of that, I was in residency, and I'm like, that is complete and total BS. I can do it all. Well, that was before children. Little did I know that it would take me a nanny and grandparents, and thank goodness I was wrong. It takes a village. What did it take you?
You know what's funny is that my number one most popular reel on Instagram is this. And my point is that it took a village. It continues to take a village. And guess what? We're all better off for the village, right? My village have been my parents, my in-laws, my husband is a gem of a human being, my siblings. We had nannies, but also my husband was working full-time, but I was still on a resident salary. We all know childcare is expensive. It was all of those things, and that's what got us through. But it was resource heavy, and I don't ever try to take full credit for it, because that's laughable. But you know what? My kids are a product of the village, and they are grounded. They are adapting. They speak multiple languages. They have all of these traits and characters that I realized that I actually also had and have, because I was raised by a village, because my mother was a physician. She was actually a medical student and resident when I was young. And I was raised by my aunt and my grandmothers and, all the aunties, and it only made me better.
Well, what do you say? And thank God we're backed up by research by this, but what do you say when people wonder aloud or are flat out, well, you don't see your children much, or what are they going to do when you're a working mother? And because a lot of women carry guilt about that, I carry no guilt about that. But what are your thoughts about that kind of reaction to women like us?
Yeah. Motherhood's its own journey, just like our jobs as surgeons. That's its own journey too, right? And so I think every woman should have the right to craft and design that journey the way that she wants it, without force or guilt. So if you choose to spend your time at home with your children, that's amazing. I hope that you were able to make that choice with the full support of your loved ones, right? You don't need any judgment from those who work. Same goes the opposite. If you choose to craft your motherhood journey as someone who works, more power to you to do it that way as well. But keep in mind that it goes both ways, right? Presumably all of our goals, are similar in that we want to raise good kids. Yeah. And I hope that what you are doing is beneficial for both of you, that both your children and you are benefiting from it. But also kids learn by example all day long, all of these cues, right? My sons are not only being raised by a mother who works, they're raised by a father who's married to a woman who works. And that is going to change how they approach relationships, how they approach parenthood. That's going to change how they interact with women who they may employ, who are their bosses. It's going to change my sons and my daughter. And to me, I sit very comfortably knowing that all of my children, regardless of gender, are learning from the cues and the lessons that my husband and I put forth every day, treating and approaching parenthood, marriage, and our jobs the way that we do. I have no guilt about that.
Well, and I'm sure what they're seeing is what our children see in our house is this true collaborative relationship that neither one of us are in one lane. We're always working together. And I think that's a beautiful thing for children to witness, don't you?
So it's so beautiful, and it's beautiful. We're all learning, right?
Yeah.
I mean, my husband and I have evolved so much in the 12 years we've been married. And I had this one reel where I talked about, you know, spend a little time with your oldest because he watched you grow up before you figured it out.
Oh.
And that's how I feel about my son, who was born when I was a general surgery resident and watched me through multiple fellowships and all of that. But I also think we all grew up together, but we also witnessed some really beautiful lessons together. And I know, I have no doubt that they will be better people for it.
And he can't help but have learned a work ethic, right? He's going to always remember what it takes to be successful, which you certainly are. And I've loved watching that online. I think the first time I saw you, you were opening your gorgeous, listen, this place is so gorgeous. I'm so happy for you. Office, where you're doing really special things for women. And I want to get into the difference between traditional reconstruction and flap reconstruction and who should be indicated, because this will be the first time my audience has talked about the kind of work that you do. But I want to know, listen, you could have stopped after general surgery. Sometimes people do. For people that don't know, that's 5 or 6 years long. And then you could have stopped after general plastics, but you didn't. You went on and did more work. What drives you? What is that in you?
I think I'm an immigrant. I'm also a child of immigrants.
Mm-hmm.
And I also have always felt, regardless of what specialty I was going to go into, if I put all the tools in my toolbox that I could possibly need, there's always room for excellence. So no, I always knew I wanted to come back to LA. At that time, I wanted to be in academia. And I thought, you know what? If I have every tool that I need in my toolbox and I'm excellent at it, there will always be space for me to do my best work. And I believe that because I watched my dad live that every day. I watched my mom live that every day. I watched my husband live that every day. And so I think I've been inspired by all of those. I watched my grandmother and my aunt, and that's the thing. Just because I choose to work doesn't mean that I look down on women who don't. I was raised by women who gave up that part of their life and that freedom to raise me. Yeah. And they raised me with excellence and devotion in a way that I would like to mimic. And so that's why I said, the minute I figured out breast reconstruction is what I wanted to specialize in, it was a no-brainer. I got to just keep doing it. Everything I need to do until I can offer women every single thing that is out there.
Well, and that's what's really fascinating about your practice. So if people go to your website, which I'm going to direct you to go to the website, I know people travel for you just like they travel for me. You will see that you have outlined not one procedure, but literally what you just said, all the options women might need, which you are totally capable of, for breast reconstruction, from the traditional implants to varieties of implants to microsurgery. So I want to get to microsurgery, and I want you to really explain to people what that means. And listen, I was pinching my belly just now to think, do I have enough for it? No, I'm kidding. I'm not. I don't want a breast augmentation, but listen, the autologous transfer is the amazing natural solution. But let's walk through and explain to us the difference between traditional and autologous, which means using self tissue and what that takes. Just educate us.
Yeah. So when women have a lumpectomy or a mastectomy, lumpectomy being a partial removal of the breast, a mastectomy being the total removal of the breast, for lack of a better analogy, it's like either taking the stuffing or the entire pillow out of a pillowcase. So how do we reseam the pillowcase? Because why not find the silver lining? And that reseaming is a lift, for example. And then how do we refill the pillowcase? What kind of stuffing are we going to put in there? And that's how I look at my job. I am a quality of life surgeon, and I embrace that. And so traditionally, that has included the use of implants. Some surgeons, most surgeons will use something called an expander, which is like a temporary device. Think of it as a balloon, and you can put in fluid from the outside and gradually expand this device until it is the shape, size, orientation that you want, and you swap it out for a breast implant. I offer direct to implant because the reality is we've gotten so good these days at mastectomies and nipple preservation and blood flow preservation, we can now get fancy and go direct to the implant. But a breast implant, here's another great analogy of mine, for lack of a better analogy, is like they're like tires on a car. They expire. The manufacturers do not hide the fact that they are temporary devices. So just like your tires, at some point they're going to pop, they're going to leak, something's going to happen, you're going to drive over a nail, and you're going to need to get it swapped out. It may happen where it's emergent, where the whole thing pops and you got to get it out, or it might happen gradually over time and you have some time to figure it out. But they are temporary devices. So the inherent negative for a risk of an implant is that it's not a permanent device. You're going to have to do something to it in the future. Other things are more nuanced. So they can get infected. It's not a part of you. They do feel cold. That said, they can provide a reliable and an aesthetic breast reconstruction if that's what the woman wants. The real reason we had to look beyond implants is that a lot of women get radiation therapy, which is great for treating cancer, but not so great when it comes to aesthetics and symmetry and longevity of the implant. So we started figuring out how to do transplantations, but in the same body.
Yes.
And the fun part about this kind of transplant is I'm transplanting fat. So wherever you don't want it, right? A little pinch of the belly or the thigh or the lower back love handle area, we can take that fat and the blood flow that comes from it without sacrificing blood flow anywhere else, just the pipe that goes into the fat that you want to take, and we can make a breast out of it. And it was really born as a solution for women who had complications from radiation, open wounds, really devastated skin, or implants that failed. And then what we found is, hey, this is a permanent solution. This will last as long as the patient lasts.
Yeah.
This doesn't pop, rupture, leak, form scar tissue.
Yeah.
And what we found is that long-term studies show that women are happier with this option because it's their own tissue.
And does it feel like self tissue? It feels soft? Because I think sometimes women describe to me their implants get encased and they feel harder, or hugs feel different than they did before. But this is literally the soft subcutaneous fat that we all make, right?
The greatest compliment I receive is when women, like when a patient will switch primary care providers, for example, and I have to call that primary care provider to promise that they had mastectomies because they can't tell.
Oh my goodness.
And so they're sending the patient for a mammogram. Now I'm like, oh, you don't have to do that. She actually had, but we saved the nipple. We saved the skin. It feels natural. They have no idea. The scars look like a breast lift. They don't know that the woman had reconstruction. And that is not only the ultimate compliment, but also the ultimate reason that I think it's so important to be able to offer the whole spectrum and then let the patient decide, because that's the crux of informed and shared decision making. I'm going to tell you the risks and benefits. And in most cases, tomato, tomato, you pick what makes sense for you. Now, with radiation, open wounds, that's a different conversation. Then I am going to favor the safer option. But a lot of women, especially because we're catching cancers early now, they don't need radiation. And I think both options are reasonable. But some women will say, hey, if this is my silver lining for having to go through this thing that is breast cancer, I'm going to take that tummy tuck.
Well, and thank you for getting to that point. As I'm envisioning as a surgeon, and I've seen some of the things you've posted, when you remove, say, the excess abdominal tissue and transplant it up, you go under the skin, you bring the flap under the skin, right? Or you bring
We
it,
disconnect it. We disconnected. The old version of the
all.
surgery was a tram flap, and that had to be tunneled. The
Yeah.
new version, we completely disconnect, and then we put it in where it needs to go, and sew the blood vessels together.
And sew the blood vessels together. And then you sew the edges of the skin together. So they're left with a little tummy tuck scar. It's like a mommy makeover, tummy tuck scar.
And we actually, you know, not everyone does this, but when I do it, I do the full tummy tuck. I will fix their diastasis, or, you know, right. I'll do the plication. I'll zip up their ab muscles. We'll do those progressive tension sutures to kind of give them that, you know, the abs and the V, all the things that we do in cosmetics. I can't say we, but I do, because I think it's important. You can't steal from Peter to pay Paul and then leave a problem, right? So if I'm going to take from your tummy to make a breast, I want the tummy and breast to look as good as a mommy makeover.
And then when you sew the vessels together with under microscopy, how long does it take for those two structures to heal completely? And is there ever an issue with occlusion?
Yeah. So the risk of microsurgery would be a blood clot that forms in either the artery, so all the blood coming in, and then the vein, which of course takes the blood out. And that risk is for about 48 to 72 hours. So most surgeons, not all, would have a paradigm of monitoring the patients during that time. And different flaps have different risk profiles, but you're looking at failure rates of about 2%, which is pretty low, especially if you're comparing that with the percentage of women who undergo multiple operations in their lifetime because of scar tissue or migration or whatnot, whatever may come with an implant.
And so when you do that anastomosis, are you anticoagulating at all? Or for people listening, thinning the blood, or that's not necessary?
I do give a little something. We give them a little subcutaneous heparin, just a little shot. Some women come to me and they have pre-existing conditions that increase their risk of clotting. So I do modify the amount of blood thinner that we give based on that. But usually it's pretty minimal. It's not more than what a surgeon would do for any routine surgery where they would admit a patient.
And so after you've created the new breasts out of autologous or self tissue, I mean, for those of you listening, I cannot think of a more natural thing, because in orthopedics, people are very hesitant to get a metal knee, or what kind of metal are you putting in me, or what are the anchors made out of? So I don't know if with traditional reconstruction, you get the same questions.
Yeah.
Implants, but it is amazing. Well, in orthopedics, we do autologous things too, but how amazing to be able to use that tissue. What is the recovery like? Because, you know, we've all watched enough TV, women come out all wrapped up, they go home, we unwrap, we reveal. But what is it really like for a woman to heal in that mass of tissue, protect the vessel anastomosis? What is it like for people?
I tell all of my patients, it's going to take you 6 weeks to recover from whichever operation you have, because it takes about 6 weeks for us to heal our incisions enough, even in orthopedics, right? 6 weeks is kind of like that buzz term that we all use. It's how hard those 6 weeks are that I think vary. I think with flap surgery, I'm pretty honest that the first 3 weeks are a lot harder because you kind of had two surgeries. Not only did we do the breast, but oftentimes the tummy tuck part of it even hurts more because we're zipping up the abs and we're doing a full tummy tuck. There's drains, all of that. So I always say you're gonna feel like you got hit by a truck a little bit. I don't like to sugarcoat it. Plan for help. You're gonna need help with getting in and out of the shower, using the bathroom. The drains come out usually by 2 weeks. That's definitely a mark of freedom right there. By about 3 weeks, I start getting the, can I go out to dinner? Can I take a short trip? Can I start driving? That's how I always know that they're doing a little bit better. And by 6 weeks, assuming everything's healed, I give them license to travel internationally, full working out. Obviously, you can't go 0 to 100 overnight, but to really start going back to their version of normal life with no restrictions. I do tell women, though, breast reconstruction is a journey. And even in the best of hands, in fact, especially in the best of hands, you're going to need a revision operation. It's a tall order to do everything at the same time as your cancer surgery. So let's do the heavy lifting, which is the transfer of the tissue. But when they come back, we do little scar revisions, liposuction. We borrow that fat, we graft it back in. Really take a nice result and make it an exceptional result.
Amazing. And that not only includes what you just described, but in your clinic, that includes nutritional consultation. Talk to us about how you prepare prehab nutritionally and definitely post-op nutritionally for best healing?
Yeah. When we really started paying attention to vitamin D, what we realized is that women are notoriously vitamin D deficient. And it didn't matter which surgical specialty wrote the paper, that vitamin D deficiency was statistically significant as a predictor of poor outcome if you were deficient in it.
Mm-hmm.
Colorectal put it out, plastic surgery put it out. Every specialty has their version of that paper. Especially if you're going through cancer and chemo and cancer therapies, there is no doubt that you're vitamin deficient.
Yes.
And in some ways, we're really good as a multidisciplinary specialty. And in some ways, I think we have a lot of work to do. So I think mental health, nutrition, physical therapy, and lymphedema therapy are the four things that are almost always missing. I'm going to add fertility therapy or hormone management as not a soft fifth, but I think it's something we definitely need to focus on, but more long-term, not just necessarily around the time of surgery. And that's where I like to remind everyone that specialists exist, insurance covers it. We should get you to see these specialists, because I could do the best job in the world, but healing is going to be hard for you if we don't take you through all these other things. So protein intake, minimizing sugar intake, optimizing vitamin D. A lot of these women are anemic as well. So just optimizing that, having a plan in place, I think is really helpful. Prehab, when it comes to physical therapy, I think is really important. I actually am very liberal with postoperative movement. I'm like, get up and get moving. If my flap is dependent on you being like this to work, I need to do a better job. So my flap's fine. I'm not worried about it. Get up, walk around. Day one, they're meeting with physical therapy. I'd have them all get a stress ball. I do all the little things of not only will this help you do better, it's going to decrease your risk of lymphedema. The amount of frozen shoulder that I see in my practice is just, why are we ignoring this? It is not normal for us to operate on you and for you not to be able to go like this. So if that is happening, we need to critically think as care providers, do we need to change how much we're paying attention to this? Are we discharging them from our clinic too soon? Are we not being deliberate about the information that we're giving them? So I'm really picky about it. And all the time I'll get, because, the hospital is used to a whole bunch of different doctors. Yes. And they'll go, well, a lot of our surgeons say, can't move the arms, no overhead reach. And I go, not my rules. My rules are different. I want them up and I want them moving. Lymphedema is another thing, especially when surgery is involved. So how do we minimize the risk of lymphedema? We know that early range of motion decreases the risk of lymphedema. So let's think about that as well.
Right. Well, I love that approach. The other approach I love is, your headphones flipped off. I don't know.
Yeah.
I don't think we need them. And we'll just edit this. The other approach I love is that you take the time when women need it to do nipple tattoo. You may have beautiful breasts, but it doesn't feel the same unless they look the same. So talk about that a little bit.
Nipple reconstruction, I always say, is the cherry on top, but it's actually the most important part of the sundae, because you're still going to look like a Barbie, with no physical sign of being a human if you don't have nipple reconstruction. Yeah. Our 3D nipple tattoos are so amazing these days that a lot of women opt not to do a physical nipple reconstruction where you move the tissue around and create that bump, because a lot of women also get used to not wearing a bra after surgery. And so they get annoyed then because you can see it's always protruding. It's not like a natural nipple, which could then go down and come up. So whatever it is, I'm just going to talk you through it. This is what it's like if you do the reconstruction surgically and a tattoo. This is with just the reconstruction. This is with just the tattoo. You pick what you want and we'll get you set up for it. And I feel like I have so much freedom to practice my specialty in the way that I feel is right. And I'm so grateful for it. And I think I exercise that right every day. I get to do this the way that I feel is so important and necessary. And so all of my patients see me far longer than even their oncologist or their breast surgeon even, because we're just, how do you feel? Do you feel good? Is your hair growing back? How's your skin? Are you happy with your breast reconstruction? Did something happen? A lot of these women will gain weight with hormone modulators, or I also have a lot of women who really change their lifestyle because of the diagnosis, and they may lose a lot of weight, especially with the GLP-1s. So that's going to change how your body looks after I've reconstructed you. Well, guess what? Insurance and federal mandates require that insurance cover breast reconstruction for the lifetime of the patient. Come on back in. Do you need a touch-up?
Do you sometimes, because of weight loss, then have to re-fat graft? You just refill it up, refill the pillow, if you will?
Yeah. And
Yeah.
sometimes we re-seam the pillow because skin gets loose after weight loss. So we'll then go back in and do a revision breast lift or a primary breast lift.
Well, and I just love the whole idea of that because it's not pulling in and out an artificial part, honestly. It's because women want to all the time, and I air quote natural because we certainly do a lot of non-natural things, but what a gift to women to be able to do this.
I think it's awesome. There are very few specialties in oncology or in cancer treatment where you can restore what was taken away. Like I can't give you back a right colon, right?
Exactly. Yeah.
But we're figuring out ways to be able to reconstruct the breast and return a quality of life in a really meaningful way. And that's why I think microsurgery is the coolest part of plastic surgery.
Well, and you know what, my experience with microsurgery is in hands where you have to reattach things in the middle of the night, which nobody loves sitting under a microscope, but thankfully yours are planned surgeries. It's a joyful experience and not a traumatic experience. But it is really remarkable. For those of you who don't know what microsurgery is, tell me if I'm wrong. It's been a long time since I was under a microscope, but isn't 9 sutures smaller than a red blood cell? It's
really small. It's finer than human hair.
Yeah. Just imagine sewing with that and under a microscope. So it's more than loops. You're physically looking into a scope.
Yes.
As you're doing it.
Yep.
Yeah. Yeah. That's really interesting. Well, what else should people know about your approach? We've talked about the different kinds of breast reconstruction. We've talked about the whole human approach you take with prehab and nutrition and movement. We've talked about restoring a woman's confidence by the way her breasts look with tattoos, if that's what she wants. What else do people need to know, particularly about recovery from breast cancer, that you've learned over time, having taken care of a lot of women?
So one thing I'm going to say, and I'm so curious to hear your thoughts on it too, is that you've got to be your own biggest advocate, and you are going to see doctors and they may not give you a good gut feeling, or you may not feel heard, or they may not give you the option that you're looking for. And a lot of people feel like, well, that's just who I was told to go see. That must be my only option. And I'm really seeing an increase in health advocacy and personal advocacy as people navigate healthcare. And I'm just here to encourage it, because I'm sure just like a lot of patients find you, a lot of patients find me after having been through some difficult things, right? And some women don't find me until after they've had the complications, or they didn't listen to their gut, or they didn't get the surgery that they knew that they needed. And some women they advocate from the beginning, and they'll come to my office before they've been operated on by someone else. And wherever you are in the journey, no matter what it is that you're healing from, it's okay to stop for a second and say, hey, should I get a second opinion or third opinion? And look, if everybody's telling you the same thing, maybe you need to have a little chat with yourself and acknowledge that that's the right thing to have done. But it may also be that you just need to go see an expert in the thing that you're looking for. Or maybe you need to find a doctor that communicates differently. And that's okay.
Yeah. My patients are always embarrassed or afraid that they've come for a second or third opinion, or that they want a second opinion. And what I say to them is that no excellent surgeon is ever afraid of a second opinion. I am never afraid of a second opinion.
I love that. that. Like, say it again, sister.
I'm never afraid of a second opinion, because actually I know I'm right, to the point that I've even operated on my own stepchildren because I knew I was the best for it and I didn't want to hand them off. But I don't say that in a bragging way. I'm just so confident in these, right? Just like you are in your hands. So if you come and want a second opinion, but you're afraid your doctor's going to be mad at you, I think that's something to pause over, right? Because no good doctor is afraid of a second opinion. They want you to be informed, right?
No, I agree 100%. And I think most doctors are not scared of a second opinion. And if you tell them you want it, they'll support you. And if they're not, then you need to pause for a second, because sometimes it's a personality thing. Sometimes it's a communication thing. Sometimes it is a skill set thing, but I am confident in what I have to offer. I do this a lot. and
Right.
and I know what I can offer, but if they're coming to me for a second opinion, I'm going to do my best to fill in the blanks, fill in the gaps, offer them, you know, an opportunity to be heard first and foremost, and then a series of my potential solutions. If they see me and they want to see somebody else for a second opinion, then absolutely, you have every right to hear the information that you need to make a
Yeah.
good decision. Please go do that.
Absolutely. And I think sometimes what women do, tell me if you agree, if it were one of our children, or if it was if we're building a house, right? We are going to find out every detail to the end of the earth. We're going to be bugging everybody. Listen, when it's my children, I'm calling all the time. But sometimes we take a step back with ourselves and we don't advocate or aren't the defenders like we are for the other people in our life. Do you find that?
100%. And because I treat exclusively women, I see it all the time. They are mothers and sisters and wives and best friends, and they will almost lead with, I just don't want to inconvenience my family. I just don't want the kids to be sad. I still want my husband to look at me the same way, right? And it's so much of that is led with this compassion and empathy for everyone else that they take care of. And I have no shame in my game. I'm like, girl, we're talking about you. And we should, if all of these other parts are part of you, then we should
Yes.
acknowledge that too. But let's peel away the layers and let's
Yeah.
talk about you first. And then we can worry about everybody else.
Absolutely. And if I can get women to really truly understand that they are worth that kind of consideration, that's good work to do, right?
Yeah.
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 So I love the work you do. And I love that you did I love how you phrase it, all the tools for excellence and didn't stop until you were ready. And it's really equipped you to do these fascinating procedures using only natural tissue. But I know this is not all of you. So let's talk about the other parts. We talked about it in the beginning, but people ask me all the time how I fit it all in. And I've just accepted that you're probably the same way like me. I'm just high capacity. I can do a lot of things at once, but still there's an art to fitting it all in. How do you do some of that? Do you block your time? Do you know you're a morning person? Well, how does it work with you?
I delegate.
That is
And
a
I
brilliant
am very
skill.
picky about my team. So everyone who works in my office is an exceptional human being. They are also high capacity. And my MA, I told her, I said, you're amazing. Let's go to nursing school. Because I know that you can do nursing school and take care of the office full time. She's in
Yeah,
nursing school.
that's so
I taught my other MA a lot about billing. And I said, if this is something you want to really look at, let's do it. And I find that there's a sense of loyalty when you genuinely lead with lifting everybody up around you. And so they work hard for me and my patients
Yeah.
because we're best friends and we support each other genuinely. They support me in my practice and I support all of their endeavors and I encourage them. And I delegate and I equip myself, my family, my parents, my husband. Poor guy's learned a lot having to be married to me, but he helps in every capacity he can. I've learned to be an intentional scheduler. Everyone makes fun of me because I'm like a year out planning the family vacations and where we need to go because I learned the hard way. When I went private, I didn't schedule any vacation.
Yes.
And next thing I knew, summer break was there and I couldn't take the time off to take a trip with my kids because I never thought I would be so successful that I would be looking at a booked calendar. So it didn't even occur to me to block the time out. So now I don't make that mistake. I always assume I'm going to overachieve and I block the time. And I'm launching a wellness and skincare brand in May, and
Well,
I
tell
have
me about
been
that.
spending so much of my time on that, and that has been yet another level of learning. Of course, I'm sure you're the same. We're always learning, and putting a lot of my own time and effort into learning about all of the things that go into launching a brand like that, but also spending the time in the lab with the chemist, creating products, for the women that are healing, the women who are healing. And it's funny because it was born out of this idea of I treat all these women, they go through chemo, they're told to stop everything and just do Vaseline. And the reality is you don't have to stop everything. You just need someone to look at your ingredient list, pull out the actives that you don't need. Yes, don't take retinol, maybe not your vitamin C right now, but you can do bakuchiol. What about some saffron extract, right? So there are alternatives. And then what I realized in spending 2 years working on these formulas, falling in love with my own products, realizing that I'm using my own products every day because it's better than the stuff that I otherwise bought. And then realizing we're all healing. I'm healing from 3 C-sections, hormonal changes as I near 40, metabolic changes, aging, right? We're all aging at different decades. My mom is healing from different parts of menopause. I have friends and relatives who are going through egg retrievals for fertility preservation. I know women who are diagnosed with autoimmune diseases, women who are dealing with estrogen depletion at different stages of their life, IVF treatment, right? We're all healing.
Interesting.
And to me, I realized this isn't just about this niche thing that I do and these women that I treat. I think I'm onto something here. I think that this concept of beauty inclusivity, we talk about color inclusivity, and we definitely have a long way to go. But what about health inclusivity? This whole mega bazillion-dollar industry that is aimed towards women, which is the beauty and skin industry. Are we really talking about the fact that women are this multidimensional, that we're all dealing with different aspects of healing? I don't think we're doing enough of it. So I'm going to do it.
Well, you know what? I never hear the word healing within the beauty industry ever. I don't think I've ever heard of the concept that it's more than just, well, I rail against this. I'm on a rampage about this terminology because I live in the longevity space, and men, when we talk about men living longer, we call it longevity in summary. When we talk about women living longer, every product says anti-aging, which I'm on a rampage against because aging is the most natural thing we do. And when you approach it from the healing arts, it takes on a much different tone than anti-aging. There's something wrong.
I actually refuse to let the team use the word anti-aging in any of the product market. I said, scrap it. I said, if you want to call it optimal aging, fine.
Yeah.
But we're not anti-aging, right? We're going to age, but we're going to do it with thought and priority and care and intention. We're going to do it. No one's trying to reverse this, like you said, the most natural, inevitable process. Yes. We're just going to do it better.
Yeah. In a very, I love the healing approach. Are you going to launch as a surprise, or can you tell us what it's called?
So the brand is Avara. And I haven't announced on my page. Well, I guess you and I will talk about when we're going to launch the podcast episode.
Yeah, we can wait until May if you want.
But I was going to wait a few more weeks before I announce it on my Instagram page, because I wanted to really, Avara Well is the handle. And I've been the control freak that I am. I've been so intentional about the marketing and who we're using to model and the message that we're portraying. Because you're right, we don't talk about beauty and healing. There's a bunch of 20-year-old TikTokers trying to sell me things all day long. That's not me. I've had 3 kids. I'm going through changes, and I want something that speaks to me, and I want to be authentically presenting that to other people. So Avara Well is the handle. We launched May 14th. Direct to consumer, the website and everything will go live. I cannot wait to send you my box of goodies of all of the things we put together. We're launching with a facial hydrator, a periocular balm to serum hydrator, and a face replenish clarifying mist, which is hypochlorous acid. It's actually the only hypochlorous acid on the market formulated with allantoin, tranexamic acid, and 2 forms of magnesium. And I think as a surgeon, like especially now you're hearing these ingredients, you get it. Like this is, if a doctor were to curate something you put on your face and it is meant to heal and it is meant to be anti-inflammatory and non-irritating and all the good things, it's going to have magnesium in it. It's going to have TXA in it. Those are the things you need.
And knowing your brand, they will be so beautifully produced.
Can I show you?
Yes.
Okay.
Okay.
My little FedEx package of goodies here. We have the clarifying spray.
Oh, it's beautiful. Oh, it's beautiful.
And then, I love, this is the Face Restore Facial Hydrator, and they're refillables. So you can just buy the refillable and pop it back in.
How good is that?
And just as a consumer, if it's something you use every day and you love it, don't pay for the packaging every time. That's worked into the cost of the product. Just pay for the product.
That's so great.
And then I love this one. So this is the eye balm, and I formulated it so that it's form stable as a solid in the jar. It's a push, so it'll dispense exactly what you need for both sides in one push. And then when you touch it with body heat, it melts into a serum. So it goes on like this nice glowy serum, and it's got just all the good stuff in it. But I didn't put retinol in it because I'm not trying to be anti-aging. That's not the goal today. The goal today is let's heal first before you need all the retinols, the AHAs, the BHAs, the lasers, all the things that everybody's doing, which is great. I'm a plastic surgeon. I'm not poo-pooing it. Get it all done. But so many women are jumping the gun to those things without healing first. So I wanted to launch with 3 products that are vetted, that are curated, that are crafted by science, that bring in Ayurveda, because it's a huge part of who I am. As you know, I was born in India and raised by Indian parents, and really East meets West, and then something that you can just trust. You don't have to ask your oncologist. I promise you this is good.
That is so great. And really from the perspective with unique ingredients and not 67 of them, right?
No, I don't have the boxes, but you'll see the key ingredients on the box. It's a short list.
Right. I feel more confident when they're teeny tiny lists, not benzo, hydro, all the organic chemistry words you've ever heard. So, well, that's so exciting. And it's a lot to launch products.
I'm learning. I mean, I knew that it would be a lot, but I'm sort of loving it.
I bet it's a whole nother aspect, and it feeds I'm about to say beautiful side of you, but meaning the other side of you from surgery, right?
Yeah.
This is not under the microscope. This is the life side of you, the other side of, yeah. I love that so much. Well, I hope that in very short order, we get to meet in person. I am so thrilled to talk to another brilliant surgeon who arguably probably train longer than I do. I don't see many people who do that. So I fully see you, and I fully appreciate and respect you for that. So we are going to direct everybody to what you're doing. And when you launch this line, I want you to tag me everywhere, because I will share with all my women for you.
I'm going to make you come to LA.
Oh, I would love that. Well, I'm there frequently, so I'll just let you know when I'm back.
Perfect. We're launching the parties on the 13th in Beverly Hills. May.
I'm writing it down, and I'll see if I'm out there. Well, thank you so much for your time today. I appreciate
Thank you for reaching out. I've been so excited to have this conversation with you because I'm such a fan, and I also see you, but in a way, like you did all of this in ortho, at a different time. And you're amazing. Keep inspiring, because the ladies like me, we love to see it.
Thank you so much. I'll talk to you soon.
Thanks for joining us on Hot for Your Health, where we bring you conversations from the bleeding edge of science, health, and culture. You can find links from today's show and connect with me at drvondawright.com. Don't forget to subscribe and leave a review wherever you listen to podcasts. I'm Dr. Vonda Wright. See you next week.